So in the previous video, we briefly touched on robots being caregivers. Now, if a robot becomes a caregiver, who is responsible for the decisions it makes? I keep coming back to this because of my caregiving experience, but patients trust. Patients get attached. They feel safe with the familiar. A robot caregiver introduces new questions. What if the robot misreads emotion? What if, some algorithm fails? What if the robot collects emotional data without clarity and without transparency? Who's accountable for all of this? The GDPR calls biometric emotion data high risk. The European Union AI Act classifies emotional AI again as high risk. And I think healthcare robots sit right at the intersection of ethics, law, and vulnerability. In the previous video, we talked about empathy burnout in human caregivers, right? But now let's talk about empathy bias in robots. No, a robot can't get tired or get frustrated the same way a human would, so it makes up for our shortcomings in that respect. But it can reinforce prejudices in its data, and it can create emotional dependency. A patient can genuinely get attached to a robot, especially as we keep blurring the line between humans and robots. So, can robots be caregivers? Technically. Robots can technically care. But humans must supervise that care. We need to keep the humans in the loop. And if there's anything that this module taught me, it's that employability in tech isn't just about, building stuff. It's about understanding the ethical weight of what we build. So a future technologist isn't someone who goes, just let the AI handle it. It's someone who goes, should we let the AI handle it? A good future technologist is someone who can accurately and fairly assess the situation and determine as a result whether or not to use AI, whether or not to let the AI handle the rest. I think what I bring to the table is that I'm not losing sight of the fact that ethics is solely our responsibility, and that AI isn't going to be replacing that anytime soon.